All right, so you're the second session. The very first session, which is normally pretty crowded, was not, I believe, the flooding and the weather and the unexpected kids being home kept a lot of people away. So those of you with kids who are having to juggle those responsibilities and duties today, I will empathize with you, because mine actually are going to school, but it was basically on parents being able to get them to them as opposed to the normal shuttles and everything. So as far as what we're talking about today, first thing I just want to do is give you an update on the Child Development Center. I had indicated the last time that we all came together that we were hoping to be fully funded and break ground on Child Development Center in August. It is September, and so what ended up happening is we had a shortfall in the funding that we had put through. We really thought that we were going to be walking in right now with about $2 million in funding. We're sitting at 1.5 right now, so needing to go out and apply to a couple other entities who have who are at least willing to listen to our request. We need to be about 90% fully funded, 90% of full funding on that Child Development Center before we break ground. So I need about another $600,000 to $700,000 before we start that. So the current status is that it's paused until I can get that. I'm fairly confident that we'll be able to close that gap. I'm fairly confident that we'll be able to do this. It's just going to take a little bit more time and effort than I had hoped. So that's the update on that. The other is just to let you know, Houston County, so still the hospital that we're continuing to work with. It's over in Erin, Tennessee. We spent some time with the state of Tennessee yesterday, dropping the application for their critical access status, which is a reimbursement model that really should financially change the shape of that hospital. All signs look good. They have not given us word yet that they approved the application, but once the state approves it, then they're going to send it on to Medicare. Once that happens, we have Senator Corker. His office is waiting on that application to hit Medicare, and then they have said that they will hand walk that through. So we're probably looking at a November, December timeframe for them to achieve their critical access hospital status, which at that point I would say you're as close as you can possibly be as a very small hospital in a very small town in a very small community being able to remain open and financially viable. So we'll keep you in tune on that. But for all of you who have gone out there and helped with that facility, I do thank you. The one thing that did come across at the state level was how important those hospitals are. We have seen that, so for any of y'all that have gone out there and seen it, for anyone that's rendered clinical care, I think you'll actually see that some of the patients that come in there are in such dire straits from an emergency standpoint that we know for a fact of at least one small child that would not have survived the transport to another location had not been able to stop there. So those little hospitals really do save lives. I'm now converted and a believer for that. And again, just can't thank y'all enough for going out there and helping that little hospital stay open. All right, so the other thing I wanted to mention, you should have seen some emails come out about the Employee Advisory Council. For those that aren't aware, we have an Employee Advisory Council. It's a legitimate committee set up by your peers. We really bring real topics there. What you should have seen come out of that is the change in the dress code. I hope everyone appreciates the change in the dress code. I appreciate not having to deal with the dress code. It was good. It was good that your representatives were able to collaborate and decide exactly what changes need to be made. It allowed us to kind of get out of the way from an administrative standpoint. I think I've talked to y'all before that, my idea of dressing down is I don't wear a tie. I'm probably not the right person to speak with about should you be able to wear jeans, t-shirts, golf shirts, whatever. Also, y'all have a lot of tattoos. But really being able to kind of modernize and see, is this really important to us? Is it not? And what's really interesting, I think, is that the patients have not complained or said anything, which everyone likes to be the voice of the patient. So especially when you're talking about dress codes and appearance, right? You always want to be the voice of the patient and say, they're not going to like red hair. No, you don't like red hair. but as through the voice of the patient, you're going to put forward your opinion. These patients don't care about your scrub color, if you're wearing a t-shirt, what color your hair is, and do you have a tattoo on your wrist. What they really are concerned about is, are you providing high quality, compassionate care? Are you listening to them and not hurting them? That's it. So it really seems to have been a win, so thank you all. But that was a big thing for that employee advisory group to do, to put themselves out there and say, hey, this is a policy, this is what we feel we need. There's spots on that employee advisory council. If you feel that areas of this hospital are not represented, if you feel that opinions are not being voiced, then it is on y'all to put a representative on there that is going to have that voice, because we are driving change through that group. So really think about it. The one thing that we're tackling right now through them is the use of emails. How are we going to communicate within this organization? Because we consistently get back on employee satisfaction surveys that we don't do a good enough job communicating. We've got our take fives that go out. We have town hall meetings. We have newsletters, right? And we have all these little blast out things. So there's a little bit that we put back on the employee advisory council and saying, look, if we consistently get this feedback from the employees, can y'all help us understand what we need to do? And one of that is, well, you also have to be an active listener. So you have to pull that information to you just as much as we're trying to push it to you. So we're looking at how can we have a subset of emails to where you will be required to have read those emails. Well, that's important, but what we also have to make sure is if we're going to mandate that certain emails get read, well, then we can't have them blended in with the Predators ticket emails, the t-shirt emails, the cookie emails, right? Because now what we're saying is we're forcing you to read these things, but they can't be watered down with all the other things that are coming through. So we're working to see how we can handle that and what we can get done, and can we get a certain distribution list set up where we say if it comes from this particular person or group, you will be required to understand and get that information. Now we also understand there's other departments in the hospital that don't have immediate access to a whole lot of computers. And so we'll work through that as well, communication boards, and we'll have a different strategy for those different people. Okay? All right, so the last thing, just want to talk about the course of the organization. Up until this point, since I've been the CEO, which was, I stepped into the interim role July 2013, it seems like all we've been talking about is expense management. Cut, 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 right? Reduce, not as much supplies, lower your costs, lower FTEs, everything. You've been very, very effective at maintaining costs within this organization. You've done a great job. The big fear as an administrator is sitting there looking at it and saying, okay, you've done this amazing job of reducing expenses, but can you maintain it? Well, for 4 years you've maintained it. I'd say you got it. It's also not fun to talk about expense management unless you're the CFO. I don't like having to talk about expense management all the time. So I want to talk about growth. We've been tasked to find a way to grow an organization, right? And by the way, every healthcare, every hospital has been tasked with this. I'm not just saying we. No one just said, hey, Randy and NorthCrest, go do this. As a business, we must find a way to grow in an industry that right now is showing a national trend of shrinking. Inpatient volumes are down across the nation. Outpatient volumes are down across the nation. But last time I checked, we're still a business. We have to be successful. So we've got to grow. The constraints that we have in growing is that we cannot back off on the expense management that we have. So we have to essentially grow without spending money. That's always a challenge. But it is a much more fun conversation to talk about growing without spending money as opposed to talking about cutting more expenses when you think that you've already got yourself down about as lean as you can possibly get. So the way that that I'm going about to accomplish this goal is we've restructured the administrative level of the organization. And so today you'll have a new face coming in and talking during this meeting. That's going to be Chris Locke. I brought him up as the VP of Business Development. Y'all know him as having been over Physician Services. He's got a task. He's got a task of going out, regaining old relationships, building new relationships, and throwing a bigger net. Because if you're providing outstanding care and you're capturing the majority of the patients within your own market and they are not bringing you back up to the levels of volume that you need, that were even historic, then you've got to go get more. So that's his job, to go out and get that done. He'll talk to you a little bit more about kind of a strategy behind that and a little bit more detail about what he's attempting to get done. But that is a main focus of this organization right now. Maintain the expenses that we have right now and grow. We've got to grow. So I'm excited about it. I think it's a great change. And again, it's just much more fun to talk about. So although you can go out to Pleasant View and see that's a big thing that we're growing out there. I think today it's probably flooded. But we are pushing around a lot of dirt and mud right now to potentially build that new medical office building out there and get that up and running. So probably we'll have that done in about a year. So that'll be a big signifier of what we're doing with some growth opportunity. So with that said, I am going to turn it over to Angie Beard, Chief Nursing, Chief Clinical.
I just got back from vacation. And while I was on vacation, I was at I took a cruise and we were on some little Caribbean island. And there were several of us, so we rented a van taxi to take us around the island and just tour us around all day. And so we get in this van that the air conditioner kind of doesn't work really good. There's kind of holes in the floorboard, like you can see the ground. The windows don't work so great, it's rattly, and we're going through these roads on the wrong side of the road, which scares you a lot, especially when you think you're doing 70 miles an hour. So I kind of leaned over to see how fast we were going. Of course, the speedometer was broken. We probably weren't going 70 around those little mountain roads, but it felt like we were doing 70. And we come to a passage where there's really not any lines in the road. I'm really not sure what side of the road we're really driving on, or what side we're supposed to be driving on. And there's more than one car, one of us at this four-way intersection, and I really don't know what the rules are when you're driving on the wrong side of the road. Whose turn is it to go first? Well, obviously they didn't know either, because they've got their windows in and they're yelling and shaking their hands and doing things, and I'm pretty sure they didn't say, "How's your mom?" and them. And I don't know how we figured out who was going to go first, but we made it through there. But I was pretty sure that was the time that I was going to meet my maker about that time, because it was a pretty terrifying experience. And so as I'm riding through that van, I come to the conclusion, I'm kind of thankful for all those tickets I've gotten, because here in the States, because we have rules. And I'm glad we have rules, because that's how we know not to have chaos, and that's how we learn to drive, is by those rules. Now, I wish the tickets weren't quite as expensive. However, I did learn a lesson from the rules, and I'm glad that we have the rules. So as I'm thinking through that, I think about our work rules also, and how we really don't like to have work rules. However, work rules are necessary to keep us safe, just like those traffic rules are necessary to keep us safe. Excuse me. So no rules equals chaos, which is what I experienced on the road, right? And we all hate rules. Nobody likes to live by the rules. So school just recently started back. And so as I was thinking about these rules, I wanted to share with you a book by Robert Fulghum titled "All I Really Know I Learned in Kindergarten." In his book, he identifies 16 basic rules. And when I think about these 16 basic rules from this book, which seem so simple, and we apply them to our work life, they're still applicable even at this level. And you think kindergarten is so simple, is so young, but the lessons we learn in kindergarten still apply today. So the first lesson is share. Share everything, including information, especially about safety. Transparency, safety. We have our morning safety huddles. We talk about patient safety. Withholding information about safety or withholding information about patients, that is a form of bullying, by the way. And who does it hurt? It hurts the patient, or it hurts someone else. Play fair. Lateral violence, bullying, schedules. How many of you have worked in departments where there's just that one person that doesn't want to play fair? I worked last Christmas, it's your turn to work Christmas, and they don't want to work Christmas, or they call out on Christmas. They just don't want to do what's fair. If somebody has to work Saturday, but it's never them for some reason, they just don't want to play fair, and it creates disharmony amongst the department simply because there's someone that doesn't want to play fair with the others. Don't hit people. Seems simple enough, doesn't it? But that includes your supervisors, coworkers, doctors, patient family members, etc. But that doesn't just mean physically. Your words can hurt just as badly. Don't hit, don't throw zingers, don't throw your coworkers under the bus. Put it away. Put things back where you found them. If you use a piece of equipment, when you get done with it, put it back where you found it. If you use anything, put it back where you found it. Return unused items to stock or inventory if possible. Only get what you need. If it's not contaminated, return it back to stock or inventory. Another thing that you need to put away. Clean up your own mess. Clean up and shine your area before you leave. We're all responsible for a clean work environment. How many of us have that one little coworker in our department that they're like, who's that Peanuts character? Pigpen. You know, they kind of remind you of Pigpen. There's just a mess that follows them wherever they go. And they never tidy up their work area or never take their trash out. You know, once again, very simple, but yet so important. Clean up your own mess. Don't take things that aren't yours. Anything that is hospital property belongs at the hospital property. It belongs at the hospital. That includes those ink pens you put in your pocket, those rolls of tape, those Band-Aids, those alcohol pads, those sticky notes. All of that stuff you put in your pocket and you take home, that's hospital property. Don't take things that is not yours. I'm sorry. Say you're sorry when you hurt somebody, whether it's a patient, a coworker, anybody. Just say, I'm sorry. Sorry is such a big, small word, and it's hard to say I'm sorry many times, especially when you don't feel like you've done anything wrong. But if someone perceives that you've hurt their feelings, you can still say, I'm sorry that your feelings got hurt. It's huge. Wash your hands before you eat. And before you do anything and after you do anything. But wash those hands. Once again, simple, but how important is it? Flush. No explanation needed, but don't flush wipes. I knew I'd get it good, Steve. Don't flush wipes. Milky cookies. Warm cookies and milk are good for you. And the volunteers cook those, and we send out the email, and you need to go get some of those because they're actually, I believe they really should be a basic food group. Live a balanced life. Learn some, drink some, draw some, paint some, and sing and dance and play and work some every day. Don't just work. Play, laugh, have fun. Live a balanced life. Take a nap every afternoon, but not while you're at work. On your days off, take a nap. Or when you get home from work, you take a nap. When you go out into the world, watch out for traffic, especially if you're crossing this road. Now, hold hands and stick together. We can go anywhere and do anything together. If we all stick together and we all have the same goal, we can go anywhere. Be aware of wonder. Remember the little seed in the Styrofoam cup that we all did in elementary school? Y'all remember that? The roots go down and the plant goes up, but nobody really knows why, but we're just all like that. The roots go down and the plant goes up. Be aware of the wonder around you. It's the little things. Goldfish and hamsters and white mice and even the little seed in the styrofoam cup all die. And so do we. Remember the Dick and Jane books. The first word you learned, the biggest word of all. Look. Look around you. So in conclusion, Robert Fulghum, who wrote the book, also says that you may never have proof of your importance, but you are more important than you think. There are always those who couldn't do without you. The rub is that you don't always know who. So always be aware of the people around you. Do y'all have any questions? What? Oh, shoot. Y'all know I want to be a motivational speaker when I grow up.
I'm ready. I will follow you.
And next I will introduce Chris Locke. He's the Vice President of Business Development.
Good morning. Thanks for your time today. I do get to follow the motivational speaker, so that's phenomenal. Let me introduce myself. I thank you for the introduction before. If you don't know me, my name's Chris Locke. You may have seen me around the last 8 years here at NorthCrest with NorthCrest Physician Services, probably sometime over the last 15 or 17 years in a variety of different roles. And I will tell you that I'm proud to be standing before you today as Vice President of Business Development. I am here to serve you and to serve this community in being able to expand the services of NorthCrest Medical Center, and I'm appreciative of being able to do it. So I've got a couple of goals today. One is maybe give some definition to business development, also give you some examples of what that might be, what it kind of looks like, and then talk about the role that you actually play in the growth of this organization. I do have an overarching goal today, and it's a personal one, and that's to not cry in public. So I dropped my little baby girl off at college late Wednesday night. And as of 7:30 this morning, I had not heard from her, and it's about 10:20, and I still haven't heard from her this morning. So I'll figure that out, and if you hear the helicopter, that's me hovering over my daughter. So we'll see what that ends up like. So we'll get to the goals. So what is business development? Business development, I think, can be best defined really by our mission. I'm going to try to do this off memory, so we'll see if this works. Rachel can correct me if I'm wrong. So our mission is to develop revenue-generating growth through existing and new lines of service, through our relationships, and by effectively communicating the quality experience of NorthCrest Medical Center and NorthCrest Physician Services to our internal and our external customers. Okay? So there's a little bit that we need to break down in that to clearly define it. Okay? One is revenue-generating growth. And it has to be revenue generating, right? I mean, you heard Mr. Davis speak about the difficulties and the opportunities that lie ahead for the healthcare industry, not just us. There's normally less money involved in healthcare today than there was last year and the year before and the year before and the year before. The reality of our mission as an independent community hospital is to care for our service area, and that's everybody involved. But the realities, and we'll hear the CFO applause, is if there's no money, there's no mission. I want to care for every single person in this county, whether they have the means or the opportunity to do it financially or not. For that to occur, we've got to make sure that we care for everybody in this county, and that's those that can pay as well. Good thing about this is at a cursory glance, we have grand opportunity for growth, not only through surgical service lines, but through additional imaging service lines, and also through really bartering up our existing relationships. So plenty of opportunity. So another thing that we need to really define is internal and external customers, right? We all think we know what a customer is, and that's our patient, right? So our external customers are easy to find. Those are the folks that walk in here every day needing care. It's also us when we need care. It's also that percentage of our county and our service area that don't use us. They're external customers. They're potential customers. They're your sphere of influence. So those are easily defined. Internal customers are a little harder. That's each other. It's our sister departments within the facility. It's physician services. It's the independent physician that's on the corner that sends us business. It's maybe Nashville Surgical Alliance that, we had a patient go down to Nashville and see them. And they need some imaging. Maybe they need to come back here. And what we're doing now is identifying all of those internal customers and making sure that we are truly and effectively working to build our relationships to make sure that all services that can be done here are done here. Okay? Now, let's talk about what that looks like a little bit. One is just effectively communicating, right? So there's a new service that's going on. Dr. Goldberg is championing this, and he's performing a TIF procedure. Does everybody know about that? We all know about it, right? No, you don't. Don't act like you do. No, you don't. No, Steve does. Steve knows. Steve's fixing it. Thank you for sharing that. I didn't share that. You did. Thank you, Steve. Okay. PHI, brother. PHI. Gotcha. So I'll tell you what this is. It's a procedure for folks that are sufferers of GERD, okay, of reflux disease. It's a surgical opportunity to try to truly cure that long term for those individuals and get people off PPIs or Nexium, the little purple pill. That's not for long term use. So there's a big push in the United States right now to try to fix that for sufferers because it's a tough problem, okay? That is a service line that not only needs to be effectively communicated to our internal customers, you guys, but also to all of our referring physicians, and also really taking a page out of Big Pharma's book, but communicating that to our external customers as well. So that's a grand opportunity. And one example of what business development will do for you as a service to make sure that you are reaching your individual, budgetary, and maybe personal goals. Another opportunity that we have is, say, working with central scheduling. And by the way, that is a tough job. A tough job. Pat those folks on the back. If you ever deal with a registrar or you ever deal with somebody in central scheduling or pre-reg, man, pat those folks on the back. We've all got a hard job, but that's a tough one. It is a tough one. They also have the voice of our customer. They talk to every single outpatient customer that's going to come in here, whether they're internal or external. Man, they make a difference. They really do. So when we communicate effectively all the different lines of service that we have, or aid them in a process to make sure that we are easy to use and that we are effectively servicing those internal customers that are calling to use us, we can grow, and we have the opportunity to grow. Another way that business development can serve you and serve this enterprise is to make sure that we are partnering with sister organizations here in the community. There are also internal customers, maybe Department of Health, maybe it's EMS, maybe it's the Health Council, maybe it's our employers. And I would say not maybe, it is. Our employers benefit when NorthCrest Medical Center is here. You guys do a great job. We are a high quality, low cost facility. And when that happens, employers have more dollars to spend on their employees, and it is advantageous for their business growth, and it makes this county advantageous for business relocation. When that happens, more people are working here in the county, and we have more business. A staggering fact is 60% of the residents of Robertson County leave this county to go to work every day. So as we continue to be relevant, not in the next 2 years, but 5 and 10, growth must occur. We talked about why a little bit. This industry changes, just like all others. Mr. Davis discussed it briefly. HCA is changing their strategy. CHS is changing their strategies. Major corporations are changing their strategies to adapt. And let me tell you where we have a huge advantage. We're not sending 30% corporate allocation to Franklin. That money stays here in this community, it stays here with this enterprise. Secondly, we get to turn a lot faster when we have to adapt to a change in industry. Let's talk about what our goal is for business development. Our goal for business development really is to serve you. We're the helpline. When you're into your department and you have that voice, you have that idea, you know better than anybody how to grow your department, how to increase the volumes that you see every day. You have that voice. If I haven't tapped you on the shoulder, reach out to me. And let's develop a strategy that can be facilitated for you so that you can continue to do a great job with expense management, but yet we can put growth strategies in play for you. It's hard to do both. Hard to do both. Now, I talk about your voice. Growth and true business development does not occur, nor does it stand and fall, because you got a dude that looks like Pat Sajak standing up here talking to you. Okay? That's not how this happens. How it happens is that you use your voice, and I will ask you to make a commitment today, and I feel like we need to bow our heads and close our eyes, okay? But the reality is I'm going to ask you to commit to saying yes. I'm going to ask you to commit to having a growth attitude in your departments. If you find yourself going, we can't do that. If you find yourself saying, that'll never work here. If you find yourself saying, you know, we looked at that 17 years ago, and that just wouldn't work. This industry changes. And it is so hard to get out of a no attitude when you have focused on expense management and cuts for years. It's hard to do. It's hard for me to do. Now is our time. Now is our time to make that commitment and truly be an ambassador for NorthCrest. You all have a sphere of influence. Use that influence. And if we're not good at what we're doing, let's talk about it, correct it so we can. So that's my spiel for today. Does this make sense? Do you have any questions? Just open up. No? All right. Hey, thank you very much, and I will introduce Ms. Kim Pridgeon, the Chief Financial Officer.
So I'm Kim Pridgeon. I think y'all all know me. I see a numbers group out here in our audience. Kind of like that. So to tag on to what Chris and Randy have been saying, can't outdo Andy. That was a really good presentation, wasn't it? I want to go back to kindergarten. Times were simpler. But we talk about growth, and we talk about we're not going to do expense management anymore. Let me rephrase that. We're going to continue what we're doing. We're not going to harp on it like I've been harping on it. Why growth? Come on, y'all are intelligent. And it's 10 o'clock and we're all awake at this point and hopefully dried out. Why growth? Why are we focusing on growth? To simply put it, from my perspective, and I apologize if I'm hitting that, to increase the bottom line. So we didn't meet budget in July. We're on target not to hit budget in August. So we've done really well. We were low on cash, and we've built that up, and we've maintained it all this time, which is part of your expense management. You spend what you have coming in. At some point, that doesn't hold anymore because you have things coming in and coming in. And the easiest thing to talk about is the raise. We want a raise every year, right? Pretty much every year we want another one. So you're adding that expense in, even if you're keeping your revenue this way, you're continuing to adding expense in. So let's think about home. And if you're bringing in the same amount of money, but yet you want to do something with your home. Who wants to put a pool in? I can't because my entire backyard is a septic system. So if I could, I am putting on a porch cover. So in my home, I've allocated how much I want to put on that porch cover. If at some point my revenue, my cash coming in, drops, what am I now tapping into? My savings. So look at the business that way. We've gotten to this level, we have our savings. And if we don't continue to grow, guess what we're going to tap into? Our savings, which is not what we want to do. That's my take on growth, why it's so very, very important for us. Because we've gotten really, really good at expense management. Really good. Now we're going to up it. We're more sophisticated now than we have been in the past. Let me talk a little bit about the accounting world, if you don't mind. Payroll. Our payroll system's going away. We are so not excited about that. So we're having to get a new payroll system. The new payroll system is going to be different. You may change the way you clock in. You may clock in via a telephone. You may clock in via your computer, or you may swipe, or you may not. You may have to go out and get your W-2 online. We won't be passing those out anymore. So the cool thing is you now can always find your W-2, your pay stub. We may not be giving those to you anymore. You may have a patient portal, Lord, listen to me. An employee portal where you go and get that information. Your timekeeper, you timekeepers may be doing something a little different to get that information in. Now remember, it's a payroll system. So you have to put the hours in and it cuts a check or it makes a direct deposit. Payroll processes have not changed, just how you do it within the system will. Now this is just to plant the seed for you and your staff that we're looking at a January start date. We will become more educated, we will send out information the closer we get to that process. But this is just to get you ready. Our payroll system is changing. And we wish it wasn't, but it's a sad fact of life. HMS has said they're not going to do it anymore. Dang them. Any questions from the financial perspective for me?